Okay, Mary, so thanks for sending through your appraisal form before the meeting. So now we've gone through the part regarding your objectives, so looking at your last year's objectives and setting your objectives for this year, and we've gone through your KSF as well.
Okay.
So now the part that we'll go through is the part called the talent conversations. Okay?
Okay, thank you.
Are you all right with everything so far?
Yes, thank you.
Okay. So the section that we're on now is section 3, which is the talent conversation. So have you managed to look through the information that I'd sent round the team in regards to the talent conversation?
Yeah, I did. I had a quick look through it before today's appraisal, and I had a little look online as well at the resources. I wasn't quite sure about the leadership behaviours.
Right, okay.
But I think are probably essential in most of them.
Right, okay. Well, we'll go through it then together, shall we?
Yeah.
Okay, so the first part is about your leadership skills and your future development. So what are your current leadership skills?
Well, at the moment, I'm a Band 5 nurse working within the team. I've been there for a couple of years. So I think my leadership skills are more around supporting the team when I can, and mentoring some students as well. You know, making sure that the care assistants are looked after, and helping them as well.
Okay, right. So we'll go through now the leadership behaviours, if that's okay.
Okay.
So did you manage to have a look through all this?
Yeah, I had a look through it, and I think in a couple of them I might even be heading to proficient.
Right.
But,
well, let's talk through that then, shall we? Okay, so for the role, so just to be clear, for the role, we will be saying it's essential.
Yes.
And then what I need to do with you today is to go through and assess where we think you are in regards to that.
Okay.
So for these, it will be essential. And then, so the first one is inspiring a shared purpose. So what I'll just do with you is I will talk through each one, and we'll sort of think about examples and things that you can think of, and maybe some that maybe I could think of as well.
Okay.
And to see if that meets what it says.
Okay.
So inspiring a shared purpose, so it's staying true to the values of the NHS. So do I act as a role model for belief in and commitment to the service? Do I focus on what I do contributes to and affects patient care for other service users? Have you had any thoughts about that?
Yeah, well, I think I'm a really good role model for the team. I have got a big commitment to the service, and I do try and be consistent in what I do every day, and try and support staff and mentor them and coach them. And I do think it contributes to how patients are cared for.
Mm-hmm.
So yeah, I think
Okay.
that's it. I am essential.
Okay, so doing role model for the team.
Yeah.
Yeah, I would agree that you do meet the essential for that.
Okay.
So you do meet the criteria, definitely. Okay, so leading with care. So do I notice negative or unsettling emotions in the team and act to put the situation right? Do I carry out genuine acts of kindness for my team?
Yeah.
Can you think of anything there?
Well, I do carry out general acts of kindness, because probably on a daily basis, you know. Just being nice to staff and making cups of tea and bringing some cakes in on Fridays. I think sometimes I find it difficult to deal with people who are unsettled, or you know, if there's a problem, sometimes I find that a little bit difficult to deal with.
In what way do you think?
Well, you know, if somebody's upset, obviously, you know, I'll be able to comfort them and see what the problem is. But if somebody's challenging me, sometimes I can find that a little bit difficult.
Okay. But I suppose challenge is slightly different than sort of caring for the team, isn't it?
Yeah.
So I suppose some of the examples that you've given there, I think are good examples. I wouldn't sort of say that, because part of this as well is looking at people at proficient as well, and I think you said you thought you might be at that level for some of them, but I think probably for this I would say that yes, you definitely do meet the criteria for that.
Okay.
Yeah. I know we've got some challenging people in the team, haven't we, Mary?
Yeah, we do.
But I think you tend to deal with them really
Thank
well. So yeah.
Thank you.
So the next one is evaluating information. So it's about gathering data. So do I collect feedback from service users? Do I collect and record the essential data for my area of work accurately and on time? Am I regularly thinking about ways to do my job more effectively? And can I see patterns that help me to do things better, more efficiently, or with less waste? So have you got some examples for that, Mary?
I mean, I think I do this really well because I do gather feedback from service users and make sure that it gets back to quality and governance timely. And I do collect data, and I've been involved in an audit this year as well, and worked to the deadline and had it in on time.
And how did you find that process, doing the audit?
I really enjoyed it.
Yeah.
Yeah, I really did. I'm always thinking about ways to do my job more effectively as well, and looking at ideas and reading and doing some research. And I do see patterns on that help me to do things a little bit better as well.
Okay.
So I try and involve them into what I do.
Okay.
Yeah. But I think, though, that I could fit into Proficient here, because I do look outside my area of work for information and ideas that can bring improvement and bring it to the team meetings. Perhaps I don't establish ongoing methods for measuring performance.
Right, yeah.
So would I, because I do look for these examples, would that put me in the Proficient area?
I think from the examples that you've given me, probably not, because I think that you've talked about your audit, haven't you?
Yeah.
And we've done one audit, haven't we, in the team?
Yeah.
And I think also in regards to, yes, I know you are very good at sort of networking and sort of linking in with other departments, but I suppose it's about, is that sort of happening regularly?
Okay.
And are we finding that being brought back into the team as well? That's what I would be probably expecting for that a bit wider, and that wider information sharing, so we can sort of quantify that sort of made those improvements. So I think that you're nearly there, but I'd say for this first one, I'd be more comfortable in saying that you're meeting that as opposed to exceeding it, because I think when we get to exceeding, that's when we'd be looking at Proficient. And there's nothing bad about that, so don't think that that's sort of putting you down in any way.
It's just that, I want to try and maybe move on in the future, and I was hoping that I would meet some of the Proficient areas to help me to become a team leader.
I think then, if we talk through, because we're only on number 3 now, so it gets to number 9, doesn't it? I think there's a couple of others that maybe you would be doing that, because I know that you're a really good member of the team, and I know that you're really wanting to progress as well, because you've talked about that in your one-to-ones with me. And I think it's about what opportunities we can find for you to sort of develop them skills, if that's okay.
Yeah. Okay.
So do you feel comfortable in having that just at meeting? But I do think that with another year or so, definitely you will be in that next level.
Okay, thank you.
So connecting our service, so recognising how my area of work relates to other parts of the system. So do I understand the formal structure of my area of work and how it fits in with other teams? Do I keep up to date with changes in the system to maintain efficiency? Do I hand over effectively to others and take responsibility for continuity of the service provision?
Yeah, I think I do meet that behaviour level. I do understand the formal structure of my area of work and how it fits in with the team. We're part of specialist nursing, so we do communicate a lot with the other teams as well. There is constant change within the system.
There is, yeah.
But I really,
think you deal with that really well.
Yeah, I enjoy change, and I find it challenging, but at the same time rewarding.
Okay.
So I do enjoy that. Handover, we do hand over effectively. We communicate really well within the team, I think. And I do take responsibility for continuity of service. You know, and if there's a problem, like for example, when my band 6 was off last week, I was able to make sure that all the work
you really did.
was done.
Yeah, you stepped up there. That was really helpful. I know, because it was sort of unexpected, wasn't it? We did expect her back in, but she was off all week, so I think you did really well there.
Yeah, thank you.
Okay, so with that one, we'll put meets criteria.
Yeah,
if that's okay.
that's okay.
Yeah. So sharing the vision. So, am I visible and available to my team? Do I communicate honestly, appropriately, and at the right time with people at all levels? Helping people appreciate how they work contributes to the aims of the team and the organisation. Break things down and explain things clearly. How do you feel on that one?
I think I am a good communicator, and I'm always visible. Am I available all the time? Maybe not, but that's because work is so busy in the community and we're out in patients' homes a lot. But I think I attend the team meetings and we make sure we hand over every morning, and I do communicate honestly with, well, I think I do anyway, with the staff, and I do try and help others because we are so busy. So we do encourage the team to to keep going, even though it's quite stressful. But look at it wider as well within the organisation, and say, look what we're doing. We're part of this organisation, and we're doing a good job.
Okay, yeah, that's fine. And how do you feel about sort of breaking things down and explaining things clearly?
I think I can do that quite well.
I think you've demonstrated that sometimes to the, especially to the students when they come in. I think you're very good at sort of encouraging sort of questions from them, and sort of, but maybe that's getting on to the next one. You have to, I don't think with this, it's not the same as some of the other things I've had to do in the past where you have to use different examples. You can use the same examples, and I think on some of them we can see that, there's really, it's shared where it is, where that example sits. But I think definitely, you have lots of credibility. People really trust in your sort of judgment, and I think you do. You instill that in the junior members of the team, even though you don't manage anybody in the team. But I think that's something that we could talk about, maybe sort of that would help you develop.
That'd be great. Thank you.
Would you be interested in
Definitely,
doing that?
Right.
Okay. So I'm just going to put down here maybe sort of thinking about line management, because that could be something that you could take forward, and it could build up some of your skills as well, couldn't it?
Thank you.
Okay. So I think that's a definite meets criteria. Okay, so the next one is engaging. So I think we've covered that a little bit with what you just said before, but I think that's definitely something that you do. I think we could maybe look at, is the next one, do you get feedback on things that work well, things you could improve, shape future plans, encourage the team to identify problems and solve them? What do you think?
Well, I think I do encourage the team to identify problems.
I think you definitely do. I think you're one of the ones in the team that does.
Do I shape future plans together? I think I do try and support you
if there's
change.
Yeah, you do.
I don't ask for feedback from the team on things that are working well, and maybe
that's something we could think about, isn't it? Yeah. So I think definitely we'll put that for meeting. Yeah. Okay. Holding to account. I suppose this is quite a difficult one when you don't sort of line manage directly. So, do you take personal responsibility? Do you specify and prioritise what's expected of individuals and the team? Do you make tasks meaningful and link them to organisational goals? Do you make individual and team goals that are smart? Yeah,
I think I meet that leadership behaviour, because I do take responsibility for my own performance and try and give 100% every day in my job, and I do prioritise what is expected of individuals, like supporting the care assistants mainly. And if one of my colleagues was struggling, I'd help her with her caseload and prioritise what we need to do.
So number 8 is providing opportunities for people to develop. Look for opportunities to develop myself, learn things outside my comfort zone, understand the importance and impact of people development, build people development into my planning for my team.
Yeah, that's a difficult one again, I think. Do I build people development? I try and do that. I try and encourage the care assistants, but because I'm not a line manager, it's difficult to make it formal. But do try and encourage them to do different things. Like, for example, if there was some courses that I thought they should go on, or you know, like an outside course, I'd say maybe you need to speak to you about that.
I think maybe with this one, that I think if we think about maybe development-wise for you, looking at line management, I think this one maybe is sort of partially met at the moment. And
Really?
I think the only reason for that is that it's how you sort of encourage that in the team.
Okay.
How do you feel about that?
Well, I thought I was meeting that because because I do look for opportunities to develop myself. I do understand the importance and impact of people developments, but perhaps you're right though.
I think definitely you're very good with the students, but I'd say that some of maybe the health assistants and it's across the team as well.
Yeah.
I'm really wanting to encourage everybody to sort of develop each other in that sort of that coaching style, in understanding that, you know, the development opportunities that are there. So So
if I haven't met this essential leadership behaviour, does that mean I've failed in any way?
No, it doesn't. It doesn't. I just think that at the point of where you are in your career, because you don't have anybody that you're supervising or line managing, I think it's quite difficult for you to achieve that one at the moment. So it's nothing about you. I think that's something that we can look at developing. So it won't hinder the fact
that I want to develop?
No, definitely not.
Okay.
But I do think for that one, it might be a bit of a partially met.
Okay.
But I think it's something that we can definitely work on over the next year, so that you can then be meeting that and maybe exceeding it.
Okay.
Does that feel okay?
Yeah.
Yeah. Okay. So in no way is that having anything negative against you. It's just in regards to where you are, but you've said that you're keen to develop.
Yeah.
And that you're keen to sort of take on some more responsibilities.
Yeah, definitely.
Because are you hoping to be a band 6?
I'd like to, I'd like in the next year or so to
try. Well, I think that's definitely something we can build up on you, because when you get... Have you looked at any jobs at band 6 level?
Yeah, I've looked at a couple, and I don't meet the essential criteria at this stage.
Okay. So maybe it's about us looking at some of those job descriptions.
Okay.
Not that I want you to leave or anything, Mary. It might be there's opportunities in the trust or in the department. Yeah. But I think it's about building up those skills for you and that experience.
Okay, thank you.
So influencing, so this is the last one now, so engaging with others to convince or persuade. How do you feel about that one?
Yeah, I think I'm good at engaging, and I can persuade people if I need, if I need to, especially if I feel that something is right. We'll have a discussion about it and I'll explain my views. I do listen to different views as well.
I think you normally, you tend to, from what I've seen, you tend to take quite a considered approach on things.
Yeah.
But I think sometimes as well, though, I can see when you need to get those people doing things.
Yeah. And I know that I give a well-reasoned argument, and I do try and express my views clearly to people. So I would hope that I meet that.
Okay, yeah, I would agree with that.
Okay.
So that's the end of sort of looking at assessing. So this bit now is I've got some questions for you. So these are the questions here. So I would like to continue my current role to maximum potential. I'd like to develop my skills within the current role, new skills, take on further responsibilities. I'd like to develop my skills beyond my current role with the aim of working in a different role, team, service, trust. I'd like to develop my skills to enable me to work at a more senior level. Which one do you feel that is the one for you?
Well, I definitely want to develop my skills within my current role and take more responsibility, but I think I do want to develop my skills beyond my current role, with the aim of working at a band 6. So I think I fit in this one. Do you agree?
Yeah, I think you're doing really well in your current role, and we've talked about that through your objectives, haven't we?
Yeah, and the one-to-ones as well.
Yeah, everything's been very positive. I got lots of positive feedback as well from the team about you, which is really good.
Thank you.
And I think that it's about then thinking, what's the next step for you? What are the things that you need to do in regards to that? Not that I'd want to lose you from part of my team,
No,
but it's
but
understanding
there might be
that there'll be some
a role at
developments.
some point, yeah.
Hopefully, yeah.
Yeah.
So what do we need to do to achieve this? So have you thought about your strengths and areas for development from this then?
So I'd agree that I need to do some line management if that's okay.
Had you had any thoughts of how that would work in the team that we've got now?
So I think mainly it'll be line managing the care assistants. We have got one assistant practitioner who's a Band 4, so I don't know how you feel about me line managing her as well.
Yeah, okay. So because there's a couple of Band 5s, and obviously I'm going through this process with everybody, aren't I? I do think definitely we could have a person reporting to you.
Yeah.
And what I will be looking at are things such as doing supervision, doing sort of maybe looking at in the future thinking about appraisals, taking forward some of the sickness absence things.
Yeah. Okay.
I don't know if you've thought about, maybe thinking about, I know we talked about the outpatient appointments, but maybe some of the more rota things, some of the cover things. And I know you pick those up as well, like everybody does.
Yeah.
But just thinking about, there might be something that we could get you a bit more involved in regards to that.
No, that would be really good. Thank you.
So maybe one of the care assistants, or like you say, the assistant practitioner, that might be a good idea. So one of those, so that you've got some experience then.
Yeah. Okay.
And you talked about sort of the audit that you'd done.
Yeah, I really enjoyed that.
Okay, so maybe it might be worth, have you been on one of the quality improvement
workshops?
Events, the workshop?
I was at one last year, but I haven't been since then. But
so maybe it's thinking about maybe with the rest of the team as well, and seeing is that something that people can regularly go to, because they're very regular now.
Yeah.
And then we could have people feeding back as well.
Yeah, no,
that's also gives you a bit of exposure.
Yeah.
Sort of going to those meetings, but then coming back to the team and sort of feeding back to the team, which I know you would normally do, but maybe we could do that a bit more formally.
Because we're so busy all the time, will I be given the time to do that? And,
What I'd want to do is make sure that we have it on a sort of a rota. So it wouldn't obviously just be you. But then I am very keen for people to sort of do that, because I think audit's something that every year we're sort of running around a bit like headless chickens, aren't we, thinking we need to do our audit. But I would rather have it more of a regular thing.
Would I be able to take the lead in this year's audit? Would that be something I could do with Band 5?
Well, I can sort of have some discussions, and maybe, we normally have our Band 6 that does that, don't we? But maybe I could see if you could help her in regards to that as well. And maybe take a bigger role.
Thank you.
So maybe not leading on it, but maybe take more of a bigger role in it. Would that be okay?
Yeah, that's fine. Thank you.
All right. So that's the end of the talent conversation now, but what we need to do is something to plot you on the talent map.
Okay.
Have you had a look at one of those before?
I had to look at it before, yeah.
Right. So here we are.
Okay.
Here. So where, had you thought about where you might be?
So I thought from performance behaviours, meet expectations.
Yeah. And then if you sort of look through the different things, where do you think you might be?
So probably, well, I'm not ready now because I need to do some. I need more, responsibilities and more experience in a senior role. So probably developing talent ready soon.
Yeah, I would agree. I think that's the area where you are, because you've got good rounded performance, praised professionally in the team, reliably meet expectations and showing potential. But happy to be doing the job you're doing now. Are you happy?
I love what I do. But I do.
I know that came out earlier in our appraisal, but it is about trying to get you those development opportunities for you as well.
Okay.
Yeah. All right.
Thank you
so that's
very much.
the end of that part of it now.
Okay. So will we review this again?
We will. Yeah. It's something that we've got to keep looking at. So we probably won't look at it in all of our one-to-ones. But maybe every other one, or maybe every couple of months, we'll have a look at this and see where we're up to. But I think the starting point is, once I've done all the appraisals, is then getting all the paperwork back out to you all. and thinking about that line management and getting that done sooner
Brilliant.
rather than later.
That's great, thank you. So what happens with this now? With
Okay.
This map?
So I have to do this with all of the appraisals that I've got,
Yeah.
and then I will be pulling that together and giving it up to the service lead, so that then there's a plan of everybody and it all gets done in the service and then in the division, and then I think it goes off to sort of HR, corporate, L&D, something like that, and then they will have a map across the trust, and it's about knowing where everyone is in sort of leadership and where we are with people wanting to move or skills gaps or those sort of things as well.
So opportunities might come up.
Yes,
Okay.
yeah, definitely.
So is there any resources I can look at?
Yeah, on StaffZone there's a number of resources there that you can have a look at, and I've sort
Okay.
of printed some things off, so I was going to hand it out at the next team meeting,
Okay.
so that people could sort of look and see, because there's free courses and there's e-learning,
Yeah.
and there's like resources to sort of just look at yourself, so sort of different books and different other websites and things.
Because I know
But
from the Band 6 roles that I've looked at, they do ask for like a leadership qualification.
They do,
Yeah.
and sometimes those do come up as well.
Okay.
But I think some of it is about building up your experience in the team
Okay.
as well. So some of the things I think that we've talked about, we can then put into
Okay.
place.
Okay, thank you very
All
much.
right,
Yeah,
okay.
thank you.